Although I personally do not suffer from thyroid disease, many people in my life do. Two of which being my mom and my girlfriend's mom. My girlfriend's mom suffered from a more serious case of thyroid disease requiring surgery. In this surgery, they cut open her throat and removed a part of the thyroid. This left a scar and took several months to heal. Even after the surgery, she required medication to help regulate her thyroid. Before she was diagnosed with this, she had many symptoms like depression, weight gain, hair loss, and stress. My mom had similar symptoms like stress, weight gain, and depression. But my mom had other underlying health problems that flared up due to the thyroid problem. It is a pretty common medical disease that happens around the world and can affect everybody. This disease can happen for many different reasons, being lifestyle choices, genetic makeup, and more. It is not something talked about a lot, so I'm going to help you understand it more. I'm going to do this by explaining the signs, causes, and ways to treat it. In the diagram to my right, it shows that there are many symptoms to thyroid disease. There is also two main types of thyroid disease: hyperthyroidism, which is an overactive thyroid, and, hypothyroidism, which is an underactive thyroid. It can cause symptoms, hyperthyroidism can cause symptoms like nervousness, anxiety, difficulty concentrating, weight loss, weak nails, thin hair, fatigue, restlessness, and many more. Hypothyroidism has similar side effects, but also some different ones. The different ones are sensitivity to cold, constipation, weight gain, dry and itchy skin, along with muscle aches, joint pain, depression, memory problems, and more. Some similar problems is you will see swelling on the throat and problems with your heart. In a study done by the Mayo Foundation of Medical Education and Research, it shows that there is over 20 million people affected by this disease, and only 60% of them know it. Also, in a study done by GoodRx, it shows that it is way more commonly found in women than in men. Men only being affected one in every 10,000 of the women. In the diagram to my left, it shows there are many causes of thyroid disease. One of which is pretty common that's not shown is a disease known as Hashimoto. Hashimoto's disease is a disease in the autoimmune. It is an autoimmune disease. It can also thyroid problems can also be caused by missing parts in the thyroid, either through surgery or born without it. Babies born without the thyroid have a lifelong problem with their thyroid, and it can cause many complications. There, there can also be a problem in the endocrine system, causing the thyroid to mess up since it is part of the endocrine system. And cancer treatment like radiation therapy can also cause problems with the thyroid, leading to thyroid disease. Infection and medicine are also common causes of thyroid disease, and a less common cause for thyroid disease is pituitary disorder, which is pretty rare, but it can still happen. This pituitary disorder affects the hypothalamus part of your brain, which is in charge of controlling how much hormones you release and can greatly affect your endocrine system and your thyroid. Luckily, treatments is pretty simple, mostly being just prescribed some medication to help regulate it. For hypothyroidism, they normally prescribe levothyroxine, and for hyperthyroidism, it can normally be treated with medicine, but is also more serious. They will prescribe an anti-thyroid medicine like methomazole but they may also suggest radiodyne therapy, which shrinks the thyroid. In a severe case shown on the left, like my girlfriend's mom, they may require surgery. In this surgery, they remove the thyroid and then sew you back up, and you will recover after a few months. Hopefully, the information I have given you will help you recognize thyroid disease. There are a lot of common symptoms for these two diseases, or two types of disease, but it's nice to know. It is also good news that it is commonly treatable and majority of the time non-life threatening. Thank you.